So these are the serial scans of the patient who had a diffuse axonal injury. Concentrate on this part, and this is the scan that was taken on the first day of the trauma. I will you can see multiple injuries. We are starting from the cerebellum. I will draw over the lesions so that you understand what are the lesions that we are looking for. The whole area is the cerebellum. As you can see, sit in the posterior fossa, and this is the brainstem. Around the brainstem, there are things called the cisterns, which are fluid-filled areas, which are now not very clear because it is filled with subarachnoid hemorrhage. The cisterns here are obliterated, indicating edema. If you scroll further up, you can see that there is a small contusion, which is a parenchymal bleed in the left temporal lobe near the temporal horn of the lateral ventricle. This is a small speck of pneumocephalus. As I scroll up, I find that there are areas of blood within the cisterns, in the sulcal spaces. This is called a subarachnoid hemorrhage, and you can see more subarachnoid hemorrhage which are inside the sulcal spaces. As I scroll further up, I find that there is a bit of a subdural hemorrhage, which is concave or convex in shape, but it is not causing mass effect, and it is only around 3 or 4 millimeters in size. Further up, you find some hematoma and again more subarachnoid hemorrhage. You can see, if you see carefully, there is differentiation between the gray and the white matter. This is the gray matter, and these are the finger-like projections of the gray matter. In the second scan, that is done after 2 days, you can see that some amount of subarachnoid hemorrhage has disappeared, and the basal cisterns that were not seen initially, this one, I will delete all the annotations. I will go to the same cut as this one, and you can see that the subarachnoid space, the cisternal space is gradually appeared. You can see the cisternal space. There is interpeduncular bleed, which is also seen in the first scan. This is interpeduncular bleed, which is again in the cistern. This contusion has remained more or less the same. Some of the patchy areas of the bleed in the cisterns are now having edema. So this is edema which has occurred around the subarachnoid hemorrhage. No new hematomas appeared, and on the surface of the brain you can still see the sulcal spaces. The gray-white differentiation is present, which is a normal thing. This is the gray matter, the gray ribbon, and you can see the white matter inside. But in the final scan, on the day he deteriorated, the whole of the supratentorial area has become hypodense, indicating loss of vascular supply, and the patient has deteriorated to E1, M1, V1, with pupils bilaterally dilated and fixed. And you can see that there is no differentiation between the gray matter and the white matter. If you take the same cut here, you can see, I will delete all the annotation again. The gray-white differentiation, which you could see clearly, this gray and white matter differentiation, this is white matter, and this is gray matter. This differentiation, which is seen all over the brain, has disappeared in this particular section. There is no differentiation between the gray and white matter, indicating loss of vascularity. The basal cisterns have completely obliterated. There is no cistern seen.